Okay, last one of the anatomy of the respiratory system. Woohoo! PowerPoint 7. So here we're going to talk about the airway histology a little bit more. So try to imagine that we're moving from the trachea. We talked about the main stem bronchi and then the lobar and segmental bronchus. Then we kind of talked about the layers of the bronchus with about 85 diagrams of the cilia. This is going to be moving past the segmental bronchus into these bronchioles and smaller airways, all the way down to the alveolar sacs. Okay, so big takeaways. In your lungs, you have what is known as your conducting zone and your respiratory zone. Okay, your conducting zone is where you are going to bring air into your lungs, you're going to heat and humidify it, remove debris, and kind of create the optimal conditions for it to move into your respiratory zone. Your respiratory zone is where your gas exchange is going to occur. So when you are talking about ventilation, the whole point of ventilation is to bring oxygen into your blood and remove CO2. Okay, so you're bringing in oxygen, you're removing CO2. That only happens in the respiratory zone of your lungs. So your conducting zone heats, humidifies, and gets debris out of the air. Your respiratory zone is where your gas exchange is actually occurring. So, this is something that I would have memorized. Your conducting zone is comprised of your trachea, your bronchi, your bronchioles, and it ends at your terminal bronchioles. And what's kind of nice about that is the conducting zone ends at terminal bronchioles. Terminal meaning end. So if you know trachea, bronchi, bronchioles, terminal bronchioles. And a bronchiole is just a small bronchi. That's all it is. You guys do not need to know this 0 through 16. I'm not going to make you number them. I do want you to know that these 4 components make up the conducting zone. When you move into the respiratory zone, you start with your respiratory bronchioles, which is pretty convenient from a memory perspective. You then go into your alveolar ducts, which are just almost like a hallway, into your alveolar sacs, which is where that gas exchange is really going to be occurring. So, memorizing the 4 components of the conducting zone and the 3 components of the respiratory zone, and just understanding the purpose of them both. Conducting zone, no gas exchange is happening. You're heating and humidifying and filtering the air. The respiratory zone is where your gas exchange is going to be occurring. So this is a close-up of your alveolar sacs, okay? And this is something where you guys are not going to have to memorize the diagram, but I do really think it's important to kind of get a visual because this is going to become a big forefront of what we're going to be discussing when we move into our systemic and pulmonary circulation and how gas exchange occurs at a more cellular level, which we're going to be learning as we move through here. So your alveolar sacs, which you have millions of, right, are surrounded by what are known as capillaries. And this gas exchange happens because you have these nice little flat squamous cells that allow gas to move freely from your lungs into your bloodstream and from your bloodstream back to your lungs. So if you think about what ventilation is trying to do, you're trying to take oxygen from your lungs that you've brought in from the environment and put that into your blood. And then you're trying to take CO2 from your blood and put that back into your lung so that you can exhale it. And this is how that process happens at a more detailed level. Again, this is not a diagram you guys are going to have to memorize. I just think it's important to start really kind of getting a visual for the big picture and the way that these things interrelate. So this shows you if you're moving down through, this would be a main stem bronchus down into these lobar bronchus, and then segmental bronchus, and then these smaller ones are bronchioles, okay? And then when you get to these end of these bronchioles, you have these alveolar sacs, okay? And you can kind of see this here, this terminal bronchiole, then you go to these respiratory bronchioles here. You have your alveolar duct, which is just the hallway or the opening till that alveolar sac. All right, and you can see they just look like little grape bunches. Around each one of these are capillaries that are going to create lots and lots of surface area for gas exchange. And we want lots of surface area for gas exchange because we really want ventilation to be as efficient as possible. All right. And as you move through and learn in more detail the functions of all of these different things, you're going to learn about all the ways that this can become compromised or patients can have problems with this, and then how we would treat that. So again, same thing, different diagrams. Terminal bronchioles into that respiratory bronchiole, you have your alveolar duct and then your alveolar sac, and just really showing those capillaries and how they're really entwined around that to create optimal gas exchange. You can see the blue representing the deoxygenated blood and the red being the oxygenated blood, and just really kind of showing that gas exchange. One structure you guys do have to know, besides really memorizing the conducting zone and the respiratory zone, is know the phrase pore of cone. It is a board question, and it's something that you'll hear referred to. And all the pore of cone is that between those alveolar sacs, and if you think about like the grape bunches, there's these tiny little openings that connect them. So this alveolar sac is connected to this alveolar sac through the pore of cone. And there's not a lot of reference where you need to know the pore of cone, but when you do, I just would feel bad if I didn't teach it to you. The other thing I want to draw your guys' attention to for this, and you wouldn't have to label it, but you have your type 2 pneumocytes and your type 1 pneumocyte. And we're going to talk about the functions of those, and I'm going to want you guys to know the functions of those. So here I have them listed out. Your type 1 pneumocytes are those really thin, flat cells. And you guys don't have to do a lot with like knowing the different cells that make up the linings of the lungs or the bronchi or any of that. But one thing that I think is important to know about the type 1 pneumocytes is that they're very, very thin and they're very, very flat. And they are designed that way so that we can have good gas exchange. So most of your alveolar sacs are made up of type 1 pneumocytes, all right? And the reason why is they're very thin, very flat, and they butt up against the capillary, and gases can move and diffuse freely back and forth. And gas diffusion is something we're going to talk about in great detail moving through this course. So this is kind of just introducing you to the anatomy of that. You have these nice thin flat cells that allow CO2 to move freely or diffuse, and oxygen to move freely or diffuse. And that's what you want when you're thinking about gas exchange. The type 2 pneumocytes secrete surfactant. I'm not going to talk a lot about surfactant right now because we talk about it in great detail when we're talking about ventilatory mechanics. So for right now, for this exam, just know type 2 pneumocytes secrete surfactant. We will talk about the importance of surfactant later on. For right now, just knowing that that's the function. So type 1 and type 2 pneumocytes and what they do. Again, here are your lecture questions. You guys can refer to the calendar for the due dates on these. I'll also probably have them under the assignments tab. And as always, feel free to email me if ever you're having a hard time with a question or you just want some clarification. I know that with online learning, it can be hard to listen to a recording and not be able to ask questions real time, as well as the fact that I'm sure I get a little bit rambly. So always feel free to reach out if you need anything at any time.